Aymeric Rouchaud, and I work with Professor Charbel-Mounier in Limoges. And now I am associate professor in the department. And today we had the pleasure to broadcast live case for AVM with WLNC, and it was a great pleasure. Yes, it's my first time for this meeting personally, but the department is really involved in the WLNC, and Charbel-Mounier already broadcast cases, so this is something which is quite familiar for the department. This is very great to have live cases and good educational teaching, and this is very interesting to have those large variety of cases and new devices, so this is really of great interest. I have a little bit of I think the venous approach for AVM was a great case, but we saw also very different cases as spinal AVM or AVFs, and yesterday we saw a huge AVM treated with 3 catheters, which was a really great case also. It depends. The venous approach is something which is quite often done in the department by Charbel-Mounier, and we did more than 100 cases, but this is just specifically for specific cases and more small AVMs. And if we need some stage treatment, we usually start with arterial approach. We don't do lots of MCA stenosis in France because this is something which is not very usual for our patients. They don't have lots of intracranial atherothrombotic disease, but for sure I think the approach which was proposed yesterday was the great approach, and mostly we do that in acute cases for stroke, because usually we don't have them on scheduled treatment. We have some dreams, I think, for our technology, and we have now new devices for flow diverter which can go through small diameter catheters, and the new challenge is to have some coatings for not only just the antiplatelet strategy, but mostly to improve the healing of the device. And hopefully we will have some new devices soon which will help the endothelialization of the device and to help the cure of the aneurysms more than just preventing the thrombosis, because finally thrombosis is not so very often with the new antiplatelet treatment we have. So what we can hope is to have something for better endothelialization.